Welcome back, folks. What does Massachusetts, Hawaii, Vermont, Utah, and Connecticut all have in common? Well, in 2017, they were all rated the healthiest states in the Union. On the other hand, West Virginia, Alabama, Arkansas, Louisiana, and Mississippi are all in the South and are at the bottom of the list of healthiest states in the Union. Why is this the case? Well, here to answer that question is Dr. Jay Maddock. He's the Dean of the School of Public Health at Texas A&M University. He previously served as the Director of the University of Hawaii Public Health Program for 8 years. Dr. Jay Maddock, thank you so much for being with us today.
Good morning, Matt. Thank you.
You know, this really, it's always more complicated than it seems. Whenever I think of the South, I think they just have great food. That's why they're less healthy states. But you've been able to identify there's a variety of reasons that lead to their lower health status. Talk to us about what are some of the reasons about why the southern states are so unhealthy.
Sure. You know, I think it's very interesting as we look across the country because county to county, we see big differences in health, and it's pretty dramatic. It's actually about 20-year difference in lifespan from the shortest lifespan in the county to the longest. And so as we try to figure out, you know, what's causing that, we see a lot of differences in health behaviors. And so, you know, we look and say, what kills Americans? It tends to be smoking, physical inactivity, and poor diet. You know, about 2/3 of premature deaths are related to those. And certainly the smoking rate is higher throughout the South, with West Virginia and Kentucky being two of the highest. We also see higher rates of obesity and diabetes in these states. And so part of it's trying to figure out why would we see higher obesity and diabetes and smoking rates in those states?
And that is amazing, though. 20 years difference. Some counties in the South versus some of those other states we listed, a 20-year difference in life expectancy. I mean, honestly, this is a big deal. We got to figure this out.
It's incredible, and you know, living in Hawaii and in Massachusetts growing up, you know, coming to Texas and saying, there's a 5 or 6 year lifespan between Texas and Hawaii. You know, what could be causing that? And it's, you know, something that was what really got me into this research as I had moved from Hawaii to Texas about 3 years ago.
Yeah, talk about. I mean, so some of this has got to be access to care, right? It's got to be. Are these states paying less for health care and making it less accessible? What's going on as far as just the institutions of health care there?
Yeah, you know, there's major shortages in primary care physicians in the South. If you look at kind of a map of the U.S. and say, where are primary health care physicians, they tend to be really, really clustered in the northeastern part of the United States. And so places like Massachusetts, you'll see more than 200 primary care physicians per 100,000 people. And in places like Mississippi, there's less than 100. You know, so it's about half. And so you got longer waiting times. And then in a lot of these states, you're dealing with the rural health, right? And so folks that live a long way away from a city, and so there might be an hour or more travel just to see a physician. We have counties here in Texas where there's not one physician living in the entire county.
Wow.
Yeah.
That's crazy.
It is.
And I guess is that they just are choosing not to live there, and they're not being, I guess, incentivized or drawn to live there.
Yeah, you know, I think you look at salaries for physicians, and they tend to be very different across the nation. And so when somebody comes to, say, Texas, and they can work in Houston in the Texas Medical Center, or they can work in a very small community in West Texas, the amount of income and lifestyle is going to be so different depending on those two choices.
Now, it's an interesting thing because it doesn't – I mean, money is one thing, but Hawaii, for example, is rated as one of the healthiest in the nation. But I'm not – are they a rich state? It seems like they've got their own issues of, accessibility and getting people off the, out of their where they live and getting them to a healthcare facility.
Yeah, I chaired the Board of Health in the state of Hawaii, and especially on the neighbor islands, access to care was quite dramatic. We had to actually airlift folks in, that had medical emergencies to Oahu for care. But what you saw in Hawaii was actually much more on the primary prevention side. And so, a state that really took smoking seriously. And so back in 2006, smoking was banned in all indoor areas in businesses and workplaces in Hawaii, and then just 2 years ago, they increased the smoking age to 21. And so a state that's really said, we're not going to pay all the costs related to smoking. We're going to be very progressive on the policy angle.
Now, so being on these public health boards, what percentage of impact do they really have? Are they a big player in the health of their communities, or are they just more, appointed positions from some governor?
Yeah, the public health boards have it depends on mixed kind of effects and how open you have a relationship with the legislature. Actually, where we saw a lot more effectiveness was in our coalition work. So the group we had called the Coalition for Tobacco-Free Hawaii, which was a voluntary group, but made up of people like the American Cancer Society, American Heart, the university, really came together as a voice for smart public health policies. And in Hawaii, we made a lot of inroads with that in terms of really influencing and educating elected officials.
It is interesting to look at also when we talk about the South. It seems like North Carolina, they have some of the best medical facilities in the country with Duke and North Carolina, and so is this about having great educational opportunities in the healthcare field? Does that help? Because they don't seem to be the states listed in the South with the problem.
Yeah, and North Carolina is an interesting one because it really is kind of on the line between the South and the Mid-Atlantic.
Yeah.
And so certainly they have the great health care. There are major health disparities between parts of the East and then parts of Appalachia, which is in the western part of the state, where you see, the opioid epidemic being really bad. And so North Carolina kind of has a mix depending on part of the state that you're in.
What should we do about this, Jay? I mean, we hear it's almost every year on the show we'll do another. Someone will do a census about the healthiest states, and the Southern, those 5 or so that are always listed in the South, they don't seem to be changing much. And so, is there anything that can be done, really?
Yeah, I think there is. I mean, so what we did starting back in 2000 through 2015 in Hawaii was we created a concentrated effort called the Healthy Hawaii Initiative, which was a partnership between the State Department of Health, the University of Hawaii, and the Department of Education. And we really said, let's take a comprehensive look at our state and what's affecting health outcomes, and the major being the tobacco use, the physical activity, and the nutrition. And let's look at all the policies and environments and then also public education that we can work on. And so Hawaii, when I got there, was ranked about 9th. And then up until this past year, when Massachusetts passed us for 5 years in a row, Hawaii was the healthiest state in the nation. So I think there are ways, but it takes kind of a concentrated effort within the states to do it.
Is it do you normally see that it's the people that push it to happen, or is it the government that pushes it down?
It happens both ways, and so certainly when the people get together and work on it, that can be the strongest. But we saw places, a lot of, and that's one of the reasons these rankings are actually fairly important. So they did healthy city rankings, and a few years back, Philadelphia was rated as the least healthy city in America. And the mayor got upset, and so he said, we're not going to do this anymore. And so that really made him concentrate and focus on it, and Philadelphia is in the bottom of no one's rankings anymore. So they really made a nice difference in that city, but it took the leadership to really make it happen.
Boy, that's great. Again, we're speaking with Dr. Jay Maddock. He is the Dean of the School of Public Health at Texas A&M University. He has served as the Director of University of Hawaii's Public Health Program for 8 years and is internationally recognized for his research in social ecological approaches to increasing physical activity. Jay, when I look at it too, it's one thing I guess to educate everybody on this, but you also have to make things accessible. You've got to have places for people to walk, activities for people to do. I mean, it seems like it gets fairly expensive.
It doesn't have to be expensive. And so one of the big policies that we worked on in Hawaii was called Complete Streets. And what Complete Streets is just anytime you build a new road or you renovate a road, you consider all modes of users. So you consider pedestrians, you consider cyclists, and you consider motor vehicles. And so as this is new construction, it doesn't really cost a lot of extra money to be able to do that. And it'll take a little bit of time, but it'll happen. Here at Texas A&M, we just launched a bike share program, which will have 4,000 dockless bikes in the fall. And the company, OFO, is actually paying for it. There's a $35 a semester subscription fee for students, and then it's covered. And so these public-private partnerships are also a great way to be able to do these things without much of a cost to the government of the state.
That's great. So they pay $35 a year or a month?
A semester.
A semester.
So $70 a year.
And have access. That's great.
As much as you want in the 4,000, you can find one anywhere. And then we tell people, you don't need to buy a bike because they're much cheaper this way. You don't need to worry about maintenance. You don't need to worry about somebody stealing it.
Overall, are we getting healthier? Is this – we hear these numbers and it's scary that one state could have a 20-year life expectancy longer than another. But overall, are we doing better?
That's a great question. Yes and no. And so we have been doing better and better for quite a long time. We've seen rates of cancer come down. We've seen rates of heart disease come down. What's happening now is, obesity has been rising, and so it looks like this generation will have shorter lifespans than the one before it. And then what's even more concerning is the opioid epidemic. We've seen this incredible increase in opioid overdose deaths. And we're seeing, especially among white women and in the South, a reduction in life expectancy.
Wow. And how do we do compared to other countries? Where are we? It seems like this is where we should be leading, but I'm sure we're not.
We're not. We pay more for health care than any other country in the world, and we finish somewhere in the 20s in terms of life expectancy and care. And so, what I always tell people is that we don't invest enough in public health. We invest a lot in care, but, if we can prevent people from getting sick, it's cheaper and we get a better result from it.
Did you see a difference when Obamacare was being instituted, where it was more money being paid to, public health and public health care at that time?
There's been a reduction in the public health fund. And so, part of looking at this, and that's Obamacare, I think, did a lot of good things, but also came short in a lot of areas. And a lot of it was having that comprehensive look at at prevention across the nation. It looked a lot at getting people health insurance, which is extremely important, but it wasn't the entire picture.
What advice would you give us, just anybody out there listening, wherever they are? You kept bringing up tobacco and physical health. What else should we make sure that we are at least advocating for, pushing for in our communities to make sure we have healthier communities?
I think a lot of it is also looking at the environment that we live in. And so we see higher rates of air pollution in a lot of the southern states. We tend to be, high industrial areas here in Texas. Obviously, oil and gas is a huge industry, so also Louisiana. And so making sure we also have clean environments. We saw a lot after Harvey coming in terms of Superfund sites, flooding and coming into communities. That's another area that certainly we can make a difference. The South tends to be disproportionately affected by heavy industry. That's
interesting, man. And then I guess too, at some point, make the city more walkable. So a lot of these cities in the South, I read in your article, just aren't walkable. They're not conducive to healthy living.
Yes, yeah, and so it was interesting. I was actually in Winston-Salem over the weekend, which rated second from last in walkability, and it's a community that's really taking it seriously. And so they're actually closing one of the major highways into town for 2 years to build a greenway, and they're building walkable trails all across the city. So, these cities can make a change, and I think when they get it, when leadership gets it, it really can make a difference. Greenville, South Carolina is another example of a city that's built this incredible trail called the Swamp Rabbit Trail, and they're seeing, differences. They're seeing conferences and business and everybody coming to the city because they've made it walkable. So I think there's a business case for a lot of these things too.
No, I do too, and we appreciate it, Jay. I think this is just great insight for all of us to know that there is stuff we can do, and the sooner the better. And we probably need to make sure we're pushing it from the bottom up as well as the top down. Jay Maddock is his name. Dr. Jay Maddock, again, is the Dean of the School of Public Health at Texas A&M University, walking us through why it is that some parts of the South are the least healthiest regions in the United States. Interesting insight. And by the way, it's not one type of, it's not one ethnicity. It's not one location. There's multiple causes, multiple effects, multiple issues going on. It's complex. But the idea that one part of this country would have 20 years less to live because of where you were born and where you were raised, that's crazy, right? We'll continue the journey, do what we can to help you live longer, love stronger, and lead healthier lives. This is the Matt Townsend Show.